Hello, everyone. It's so nice to be here with you. And thank you so much for spending the time in your day to join me. And I want to encourage you to share this with your friends and neighbors. Give it a like. Leave your valuable comments below. And also consider signing up for our newsletter. Some exciting things about that. Today, I want to talk a little bit about the chronic disease of mental health. Before we do that, let me share a text with you. That's 1 Peter 5, verse 7. It says, casting all your care upon him, for he cares for you. Casting all your cares upon him, for he cares for you. That is a wonderful text for us all to memorize. It's a wonderful text. Well, if you've been watching the news like I have, we saw this terrible unfolding in Manhattan, where downtown Manhattan, this man went into this building and killed people. And this was a tragedy, and we're still learning information about all of this. But what I heard is he wrote a suicide note suggesting that someone examine his brain. So he might have felt or known that he had some mental health problems. Well, why I wanted to talk to you about this is the Health and Human Resources just released this study, and it was released July 28th. And it looked at mental health last year. Didn't give solutions, but it told us about the problems of mental health, which just gentlemen in Manhattan probably had. So it said in 2024, in people 18 years or older, okay, the people who had mental health illnesses in 2024 were 23.4% of adults had mental illness. Of those, 5.6% of adults had serious mental illnesses. So that's about 1 in 4. And if you think about this, mental illness now is going to join my list of chronic diseases, which is already obesity up there at the top. Now we have chronic illnesses with diabetes, hypertension, cardiovascular disease. It's terrible. And here's some other statistics that were interesting. Among adults age 18 or older, 7.4% had moderate or severe symptoms of generalized anxiety disorder. So it talks about all of this. So we have another chronic health problem, and we need to do something about it. Then it talked about all of the substance abuse. And one of the things I found interesting in 2024, in the age group 12 to 17 years old, that age group, nearly 72% of that young group used nicotine, primarily on vaping. So it talked about all of these substance uses that aren't good as well. So mental health problems, whether it be anxiety or depression, which are probably at the top of this list, is another chronic disease. And looking at the statistics of it, our approach is just not working. And unfortunately, mental health causes cognitive thinking problems. People do crazy things like we saw in Manhattan. Our current system of medications, is not working. And some people really question whether depression medicines and some of this anxiety things are the way to go. But I want to suggest a couple ways today, in addition to being aware of the problem, that we can not only help others, but possibly help ourselves. Remember, when the brain is damaged, doesn't think well, we want to think about the substrates, the things that are going into the brain, and the things that are damaging the brain. We want to keep things that inflame the brain, stress chemicals, down. And I'm going to give you a few suggestions over the many ones that are out there. The first one I'm going to suggest to you today to help in mental health problems is fiber. Fiber, fiber, fiber. Well, why do we recommend fiber? 85% of Americans don't get enough fiber. Fruits, vegetables, flax, things with comes from plants. Well, what fiber does in the gut is it makes good bacteria, makes a substance called butyrate, but it also in the gut we make neurotransmitters. These are the hormones that the brain needs, like serotonin. So just eating fiber not only helps you make more and better neurotransmitters, but it also helps decrease inflammation. Remember, a lot of the medications don't cause you to make neurotransmitters. It just changes the brain so the neurotransmitters like serotonin stays around. Serotonin is called, a lot of medicines for depression are called serotonin reuptake inhibitors. So it doesn't give you more serotonin. It just keeps them around where the brains connect the synapses for longer. But in addition to that, it changes the brain in many ways. And some people, it even changes things for the worse. Thought patterns worsen. So just eating enough fiber can increase your neurotransmitters and decrease your inflammation. That's not too hard to do. Everyone can eat oatmeal or eat more nuts or have a salad every day. We can do this. 2, exercise. Exercise helps with inflammation, helps the body get good oxygen in the brain, helps the brain work more effectively. And if you can exercise outside where you get more fresh air, you might also increase your vitamin D. Vitamin D is very important. And if you're not outside much, you can get your vitamin D levels. But a lot of people that are having mental health problems benefit from taking a vitamin D supplement. That's not hard to do. 2,000 to 4,000 international units a day of vitamin D. So we can eat fiber, we can exercise and walk, we can take vitamin D. Another very important thing is to avoid brain toxins. And in this study that was released by the Health and Human Services, they listed a bunch of toxins to the brain. Alcohol, 46.6% of people drank alcohol. Tobacco, vaping, then of course illicit drugs like cocaine. Prescription drug misuse, especially opioids, marijuana, hallucinogens. All of these things are things that can damage the brain. And you have to look at that too. And there's other things that can damage the brain as well. So anything that causes inflammation, lack of sleep, lack of water, lack of movement, all of those things can increase inflammation, make the brain not work as well. When it doesn't work as well, it leads us up to mental health, which 1 in 4 people have. Many more people have this and are undiagnosed. Wow, lots of things. So if you might be one needing more help, I've done videos before about helping mental health, but we're going to really start focusing on this more. There's a couple things. If you need help right now, you can go to the phone, hit 988 text, and that will get you some help. Or if you're on the internet, go 988 Lifeline, LIFELINE.org. But also, I don't want you to forget this text, because when we come into worship, we also change the physiology of the brain. We turn down the stress chemicals, which is causing lots of inflammation, which might be hurting our blood vessel, which might also be damaging our DNA. So we want to put this text to memory and pray about this. Pray not only for people that are suffering, but pray for our nation, as 1 in 4, perhaps even more, are suffering from mental health problems. The brain is malfunctioning. And I didn't even get into all of these stimuli, these negative things that can be causing addictions like pornography, gambling, those other sources of dopamine. But here we have a great biblical prescription. It says, cast all your cares, your health cares, your mental cares, all of this upon Him. Tell God about it. Ask Him to guide you to solutions. And we're hoping He's guiding you today to this video that you can use to help yourself, and also you can share with others who might need it. We're going to talk more about ways to do this, for He cares for you. And in this world that we live in, how many times can you say, listen, this person cares for you? Do you think Big Pharma cares for you? Probably not. Do you think other people care for you? I hope they do. And I want us all in this community at Heartwise and Biblical Prescriptions to Life to be caring people, to pray for each other, to try to help each other. We've talked about some things that are causing problems in at least 1 in 4, perhaps more. We talked to some simple things you can do today: an awareness, fiber, exercise, vitamin D, avoiding toxins. There's another important enzyme that sometimes does not get into the brain. Not an enzyme, but a substrate that the brain needs to make neurotransmitters, and that's folic acid. Some people do not get folic acid into the brain because it doesn't cross the blood-brain barrier because of a deficiency in the enzyme. Well, you can also sometimes take another supplement called L-methylfolate that helps quite a bit as well in helping the brain have the things that it needs to make these neurotransmitters, to help give us a greater balance, to help turn down some of these negative things. Also will help if we have the right substrates with inflammation, which I think is a key problem in the brain, and that comes from all of the stress of the world. So I gave you a few suggestions today. I want us to pray for each other, recognize that this is a problem. Leave your comments below. Those of you that need help, we're going to pray for you. If those other people have some suggestions of things that work, naturally especially, we want to put those things down because this is a chronic disease. If we don't do something about mental health problems now, not only does it it hurts us from connecting with God, but it hurts relating to each other, but it's also something that's going to hurt the entire nation, and we can't afford having another chronic health problem. So I think the Human Health Services, this new data is good at pointing out all of this stuff that's going on. We talked about this, and we have 2 sites that you can go to. You can text 988 or go to 988lifelong.org to find support. So I just wanted to bring this to you today because it's really been on my heart, chronic diseases and mental health. If we're thinking better, we can connect with God better, which is going to lead us to ultimate healing. But we have to recognize that there's problems out there, recognize the current system is not working, and come up with some practical things that we can do today. So I just want to wish you some good health today. I'm Dr. James Marcum. I'm going to be back soon with yet another biblical prescription for life.